Canada. So I'm Jane Howe. I'm a senior manager at Deloitte in Ottawa in our public sector transformation practice. So I'm so excited to host this event for you in partnership with IPAC. I think this is a really important discussion, and it's a little bit of a different format than normal. So it's a virtual event this year. So interested in your feedback kind of once we get through the event, but we're doing a really kind of quick hit learning before the day even starts. So 45 minutes, I promise to get you out of here by 9. And hopefully you get a few insights, a few little nuggets of learning before you even start your day. And so really excited about the speakers that we have today. The focus is lessons learned from COVID-19. So, I mean, as a result of COVID, organizations and individuals have had to develop new routines for just about everything. For different government leaders, it's meant quickly innovating and adapting operations, capabilities, and strategies to accommodate for the new normal we live in today. The speakers you'll hear from today will share their organizational challenges as a result of COVID-19, how they responded to deal with the resulting change, and the outcomes and lessons learned. So now, without further ado, I'd like to introduce you to our first speakers. Sharif Abdu, Chief Data Officer at the Public Health Agency of Canada, and Cameron Mcdonald, Director General at the Canada Border Services Agency.
Hi, everyone. My name is Sharif Abdu. I'm the Chief Data Officer for the Public Health Agency of Canada, and I'm joined by my colleague. I'll let him introduce himself.
Hi, everybody. I'm Cameron Mcdonald. I'm the Director General for a team called Border Technology Innovation inside the Canada Border Services Agency. The pandemic has obviously had an impact on everybody, but Sharif and I wanted to have a discussion with you both today about a project we've been working on called ArriveCan. Maybe a little bit about what's happened at the border. As most people would know, the border has been closed. Our traveling public, both Canadians returning and international, is down by 90+% and has been since the borders were shut in March. This has had kind of two impacts for the agency. The first is that we've implemented measures for contact tracing information, and Sharif will talk a little bit about that. But you know, we have a lot less people coming through, but we're scrutinizing those people a lot differently. But also on the commercial side of things, we are obviously in the import and export business, and we've seen a steady increase month over month of imports coming in as people tend to procure more low-valued shipments. So it has the effect of like Christmas every day. And obviously, I think the third factor would be all the logistics for PPE. So CBSA has been working with a lot of other government departments to make sure that we can import proper PPE equipment on behalf of the country.
So as Cam mentioned, border traffic came to almost a halt in March. March. So leading up to that, the Public Health Agency introduced a number of measures for travelers coming into Canada. At first, it was travelers from specific parts of the world where COVID rates were high. And we asked them to provide their contact information as they were crossing the border and where they were planning on staying as they were coming in. And we were collecting this information on paper. And as you can imagine, as the number of travelers, even large, stacks of sheets of paper that we were collecting, and at that time, still the information was actually just, being manually entered in. So someone was taking the sheets of paper and typing them in. And as more and more areas globally were considered to be hot zones, we added more countries to the list where we were requesting this information from travelers. Until such time as a decision was made that this type of information would be collected from every single traveler coming into Canada with respect to their tombstone data, so their name, date of birth, where they're coming from, as well as where they're going into Canada. And it just became an operational nightmare to deal with these sheets of paper. And let me kind of just pause to kind of give you a bit of background as to why this information was being collected. We wanted to be able to fulfill our role as the Public Health Agency of Canada, and also to work with the provinces and territories and law enforcement when mandatory quarantine measures were introduced, so that we can have a good understanding with respect to who's coming into Canada and where they're staying within the country. And if they're adhering to the quarantine measures, so that we can be able to mitigate the risk of importing COVID-19 into the country by having a good handle as to, again, the flow of individuals, where they're staying, and also if they're presenting with any symptoms. And so if you can imagine, if we were collecting this important information on paper, the amount of time and energy and the amount of hands that kind of have to be involved to be able to get the sheet of paper into something that is meaningful for us at the federal level and at the provincial and local levels, that takes a number of days. And it became quite obvious early on, and actually in a few weeks after we started this in February, that we could no longer proceed with the way that we had introduced these measures. And so we quickly came together and thought, well, how can we start collecting this information in a digital way? And that's how Cam and I and our teams started communicating quite regularly to conceptualize ways to be able to fulfill our public health mandate at the border, collect this important information, but then make use of digital tools that not only make it easier for the government of Canada and provinces and local governments to be able to do their jobs, but also to make it easier on the traveler themselves.
Really quickly, we started to implement what we called like the desktop app data capture. And within 5 weeks, we had launched 2 apps, one in each of the app stores, called ArriveCan. And at first, it was your basic tombstone information, but really quickly, the thinking evolved from, just a regular kind of web form that you would input to an acknowledgement that you would fulfill your quarantine plans, providing some communications to the travelers coming in. And then this notion that happened in the April-May timeframe of exempted travelers. So for those who know about the border closures, they're closed, but Canada and the US agreed to exempted travelers for conducting business. And so there's still quite a number of those people coming in into Canada, and sometimes several times a day. So we kind of quickly had to iterate kind of instance over instance, and we went in kind of 2-week sprints to try and make sure that we could maneuver to answer the questions that the provinces and territories and that our respective deputies were asking about people coming into the country. I would say a few months later, what we realized is that this had the precipice of going international, but being kind of the standard way. And so since that time, Sharif and I have been working with our colleagues all across operations, enforcement, and implementation to really try and figure out how to position ArriveCan as a digital by default tool. Recognizing that some people will never be able to use technology, we, I think, understand that people still have to buy their plane tickets and people still have to get places. And so if they can figure out those types of logistics, maybe there's a way that we can incentivize. So in airports, we've worked collegially with our operations and airport authorities to create ArriveCan lanes. And we started communications with various airport authorities and carriers. And most recently, I think in the last 3 weeks to a month, we've had extensive consultations with our air carriers and airport authorities to try and figure out how to best position this as a default tool for anybody entering Canada using a digital means.
I know that one of the questions that we're asked to kind of consider as we're talking to you is kind of the lessons learned that we've had along the way, and Cam, definitely touched on some of them. I've got kind of 6 that come to mind that kind of build on what Cam just mentioned. First is focusing on the end result. recognizing that there's so many different paths that we can take, but if we all know like what our common objective is, getting public health information into the hands of the federal public health agency as well as local public health authorities, that really kept us grounded so that we can ensure that we're collectively working together. That ties into the next point, which is bring everyone together from the start. Cam mentioned, working with legal, privacy, communications, operations. Our success was really dependent on bringing a lot of our partners, our colleagues together through many conversations. And so this wasn't a surprise to them at the very end of a sprint or at the very end of a process whereby then we're doing our privacy or legal check. So that was key. The second was this team approach, recognizing again, like as I said, Cam and I never interacted before, but now like we're joined at the hip, recognizing that something this significant has impact not only on two organizations, but also on every single traveler coming into the country, really requires a team effort, which also then kind of requires a change in mindset in that we're likely going to be playing outside of our typical sandbox. And so if we kind of approach it from a team approach, we can certainly accomplish a lot more together. The fourth is leveraging kind of a top-down cover. There were a number of things and a number of accomplishments that were quite significant. I remember one of our briefings early on where someone said, how come I'm only hearing about this app like a couple weeks before the launch date? And the answer to that was actually quite simple, in that we'd only been talking about it for a couple of weeks. But that just shows how much we accomplished together in such a short period of time. And that was thanks to having good top cover with respect to engaging with our deputies early on. They were able to make inroads and smooth a lot of complications that we potentially would have encountered had we not had that top cover. And then linked to that would be number 5, showing as opposed to relying on telling. Cam and his team quickly put together screenshots of the actual prototype of what the app would be. And then we were able to show that to our deputies, to our colleagues. That got a lot more people on board with respect to what it was that we were trying to achieve. So showing and not telling. And then the final point is digital can have so many different definitions to a lot of people. And really kind of unpacking what it is that means. It's funny in that a lot of the obstacles that we encountered, we certainly didn't encounter when we were talking about the paper form, when we were initially kind of putting forward at the borders. But a lot of the conversations would then trigger once we start talking about a website or an app, and yet at the root of it, it's still the same information that we were collecting. So just having this common understanding of what digital really means and what it is that we're actually changing. But all of that together, I think we've got a tremendous initiative together that we've been working on, and that still has a life of its own down the road.
Wonderful. Thank you so much. It's just so interesting because you hear about these things, but to actually get some insights into the behind the scenes and where they started and kind of how it evolved. Thank you so much, Sharif and Cameron, for providing us that insight. And I think, so you'll see through the speakers today, we've got a little bit of a flavor from all of the different levels of government. So you've got kind of a federal flavor there and kind of the borders and keeping them safe to help in the fight against COVID. And now we're actually going to turn to the provincial government. Our next speaker is Lindsay Jones, the Director of Social Assistance Reform at the Ministry of Children, Community and Social Services with the Government of Ontario. I would actually encourage you, if you're hearing anything that resonates with your own work or what you were dealing with, please feel free to chat. I know it's hard to interact and engage in a virtual setting, but you're more than welcome to do that to kind of share your own insights and thoughts as you hear from the speakers. Okay, over to you, Lindsay.
Hi, my name is Lindsay Jones, and I am the Director of Social Assistance Reform at the Ontario Ministry of Children, Community and Social Services. I am one of 6 directors in the social assistance world, and my role is to focus on some of the more transformative initiatives that the government has underway with respect to social assistance. As you can imagine, COVID-19 had a huge impact on the social assistance world, which is fundamentally about income support and connecting the most vulnerable in society to the kinds of supports that can help them to overcome their challenges. The way that we experienced COVID was from a whole range of different perspectives, but if I had to kind of sum things up, I think I would talk first of all about client needs and the way that just fundamentally overnight, things like food, rent, transportation, medicine, and access to the kinds of community supports became just such a critical issue for both the people who are already on our programs, who are already our province's most vulnerable people, and who were least well equipped to deal with this crisis, as well as people who were not our typical clients, who all of a sudden had no idea where to turn and needed help. This overwhelmed the system, and we weren't prepared. The province is responsible for directly delivering Ontario Disability Support Program, and we have over 1,700 staff in local offices across the province. So not being able to provide service in person to be able to comply with the public health guidance was an immediate challenge that needed to be grappled with. Finally, the third element would really be the pace of change. So new issues like, oh, what about childcare? What about kind of access to technology, which ended up being a critical avenue for people to actually access our services? How do we deal with shelter overcrowding? How do we kind of adapt our system from a legislative or regulatory perspective to deal with the new federal benefits that were kind of evolving overnight? These issues were coming up daily, and they all needed to be dealt with now. So those kind of 3 areas, client needs, service delivery realities, and the pace of change, I would say really sum up a bit of what we were experiencing as part of the COVID pandemic. So how did we respond to be able to deal with these challenges? Well, all of a sudden, it became very clear to everyone kind of what mattered most. And this was really the focus of everyone's attention and on generating and kind of implementing new ideas. Things that we thought were barriers before to solving problems. So your typical kind of government barriers, including decision-making processes around regulations or policies, implementation of technology, getting decisions around funding, working through various kind of collective bargaining kind of requirements. All of a sudden, these elements that we previously thought were really significant barriers in addressing challenges seem to melt away. I'll give you an example of an innovative solution that kind of came together working across the system in a really kind of timely way. Because all of the kind of client needs varied so much and were changing daily, it became apparent to us quite quickly that what we needed to do was get the funding to the service providers on the ground with as much flexibility as possible to be able to respond to those needs that only they were able to kind of see and address. The changes that we made to our emergency assistance program at the provincial level. So this is a program that provides funding very quickly to people in emergency situations. So not people who are actually on social assistance, but who find themselves in need of financial support right away. We were quickly able to change the parameters of that program so that the length of time was expanded for people to be receiving benefits. We were able to work very quickly to develop and launch a new online application that would be much more accessible to clients and connected to our back-end system to enable much faster processing around getting money out to people as quickly as possible. We had to put this into place, of course, before the Canada Emergency Response Benefit was announced and implemented, but that period of a couple of weeks where individuals were waiting for the federal benefits to come online, this emergency assistance piece was absolutely critical there. COVID, yes, it produced its own kind of unique set of challenges, but really what it fundamentally did was highlighted and amplified the existing problems in the system already. This was definitely the case when it came to kind of the overly kind of burdensome administration for clients and caseworkers of the system that really detracted from those high impact activities that actually help people. The fact that our system is just not designed with the client at the center from an experience perspective or from the kind of ability to meet clients' needs to better connect them with local wraparound supports. And finally, just the importance of being able to better leverage technology in our system. So as a result, we were both kind of able to implement some of these short-term kind of responses right away to learn from them. And now we are working towards using these as a foundation for longer-term transformation. We are shifting to take a life stabilization approach to social assistance that really recognizes and supports the importance of those wraparound supports in the system. And we're also redesigning a number of kind of our processes and the way that people interact with the system to take a person-centered approach and really break down a lot of the silos that get in the way of people feeling supported. We're focusing on accelerating all of the technology changes that we kind of have had in the works for a while, but we just recognize that we need them now. So at the end of October as well, we're launching a new social assistance digital application that's going to make access to financial assistance easier and faster for all social assistants, and then having social assistance clients with a goal of kind of straight through processing for the majority of new applications by next year. We're taking a new approach to accountability. We're leveraging data and analytics to really focus our resources on high-risk areas that will allow us to kind of take a trust but verify approach to accountability, again, pushing out assistance more quickly to those in need and to streamline all of the monthly reporting requirements ultimately. Finally, I think that this resulted in kind of a new way of working for us, both with respect to the need to and the benefit of prototyping to kind of take action, to learn and evolve quickly and not be afraid to make mistakes. And in working really closely with our delivery partners to co-design new solutions to leverage everybody's perspective and capacity. So thanks so much for inviting me to speak today, and really looking forward to understanding others' experiences of COVID-19.
Thank you so much, Lindsay. That was wonderful. The two things that resonated with me were you focus on what matters most. I think COVID kind of really heightened people's awareness of that, focusing on what matters most, and then being able to work across systems in a really kind of timely way, unlike ever before. So that was amazing. Thank you so much, Lindsay. So next up is a representative from the municipal government. So now we get the municipal flavor of lessons learned from COVID. So our next speaker is Sandro Carlucci, the Chief Information Officer at the City of Ottawa.
Hello, I'm Sandro Carlucci, Acting Chief Information Officer of the City of Ottawa. Thank you for the opportunity to connect with members of the Institute of Public Administration of Canada and to share some highlights of 2020 as we prepared for and responded to the COVID-19 pandemic. You may be aware that Ottawa is an amalgamation of 11 former municipalities and boasts one of the largest rural geographic areas in North America. We deliver services to over 1 million residents, and the City of Ottawa has over 130 lines of business. The City of Ottawa's Information Technology Services, ITS, is a key partner to all the service areas across the corporation, enabling technology solutions that support optimized, efficient, and innovative service delivery. We are known as innovative change agents, valued partners, and trusted custodians. We are change agents because innovation is at the heart of what we do. We have an eye to the future to ensure that today's advances in technology yield results for many years to come. Partners, because we engage and align our efforts to the priorities of the city departments and services by providing modern and stable technology solutions that make it possible for city staff to deliver world-class services to our community. And last but not least, we are trusted custodians of the city's computing and information environment. In consultation with internal clients, ITS develops an annual client-centric, business-first work plan that aligns with the city's and the respective department's strategic priorities and responds to emerging needs and client changes. ITS work plan goals include ensuring business priorities and legislative requirements are achieved and the return on investment is maximized. On March 13, the City of Ottawa put plans into action to help curb the spread of the COVID-19 virus, keeping the safety of our employees and residents at the forefront. The global COVID-19 pandemic necessitated substantive adjustments across the corporation as lines of business recalibrated to deliver services safely and reliably. These unprecedented times brought on many challenges, especially for those of us who are accustomed to working on-site at one of our many city facilities. ITS has been instrumental in supporting the multiple city COVID-19 response and recovery task teams, as well as regular operations as thousands of city employees were suddenly required to work from home to help curb the spread of the virus. ITS continues to work closely with our clients and partners to discover new ways that we can leverage technology to continue to innovate, improve, and integrate our day-to-day work. ITS also takes pride in ensuring we pay close attention to industry advances and prepares for and plans for evolving needs in an ever-changing technology landscape. We were watching world events carefully in early 2020, and as we prepared for our own operations, we also anticipated we would be instrumental in supporting the organization in new and immediate ways. Our proactive planning meant we were able to quickly respond to urgent needs, particularly for supporting Ottawa Public Health, emergency protective services, and community and social services. We knew ITS was going to be a critical piece of the puzzle for successfully keeping the city's business lines running for our internal clients and for our residents. Therefore, we created our own ITS response teams, a VPN connection team, a desktop, laptop rollout team, working from home support, and teleconferencing options team. Our platforms supported departments as they adapted their operations to a COVID environment. Our VPN response team ensured that our stable and reliable infrastructure was further expanded for a different reality. And with the help of our desktop, laptop ITS response team, we deployed Windows Virtual Desktop to network staff who did not have a city laptop, allowing them to securely use their PCs from home. In 2019, ITS completed the implementation of Microsoft Office 365 to all network employees. This was a proactive and an ambitious plan. Office 365 allowed network employees to access documents and the Microsoft suite of applications safely and securely via the cloud. Part of that planning included bringing a bring your own device policy, meaning City of Ottawa staff could use their own personal equipment to safely and securely access their files. This was also another critical piece in maintaining operations in the early day of the COVID crisis. I'd like to take a moment to highlight some of the initiatives ITS implemented in support of our clients' diverse needs to efficiently perform day-to-day work activities from home and other COVID-19 responses in the early days. Ottawa Public Health had an urgent need for a digital COVID-19 case and contact management solution to replace their existing paper-based processes and allow for a safer, more efficient way of managing the increasing volumes of cases and contacts. The new system also provided the ability to create reports and data extracts that were essential in meeting the daily provincial reporting requests. Another key internal client during COVID has been the city's long-term care residents, a 24/7 operations. Long-term care residents urgently required a number of communications-related technology supports. These needs emerged as residents became disconnected from loved ones who suddenly were unable to enter long-term care facilities. In response, we partnered with community and social services to provide dozens of tablets, number of cell phones, and Wi-Fi pucks. This equipment provided residents with the ability to Skype, FaceTime, and call family and friends. And we also designed a self-service online booking at 3 of the residents to improve the scheduling of phone, video, window, and garden visits. In the early days of the pandemic, it quickly became evident that council, committee, and other public meetings would need to move online to adhere to physical distancing directives while maintaining operations transparently and ensuring accountability. IT worked closely with the city clerk's office to ensure conferencing licensing, ensuring that security and accessibility requirements were met, and that the meetings could be simultaneously broadcast on YouTube. The move to the cloud not only brought us into the present, but it also positions well for the future. Without the successful migration to a cloud environment in 2019, the transition to move our administrative work staff to remote working environment would not have been as robust. Adoption rates skyrocketed as employees quickly adapted and flourished in the new work from home environment, and our return on investment has increased exponentially. And this summer, we accelerated plans to provide network access, email accounts, and online Office 365 to almost 5,000 employees within 5 departments who previously had a demographic of non-network staff. We learned some lessons about our successes and challenges during COVID. These are helping us to improve how we communicate across our large and complex organization and ensure our efforts align with evolving priorities and community needs. Successes and lessons learned will help guide us as we continue to move forward on important foundational projects and exciting innovative technology solutions that support our organization and the entire community during these evolving times. Thank you for the opportunity to virtually connect with members of IPAC. I would like to extend an invitation to reach out to, if you'd like to reach out to me, if you have any questions, or would like to learn more about the City of Ottawa's IT services. Thank you.
Thank you so much, Sandro. That was wonderful. I mean, it's just so interesting to see what you were able to do in terms of enabling employees and stakeholders within the city and providing technology to support them in this new normal. I think it's so wonderful, and I loved hearing about how the city partnered with community and social services to provide technology support for residents in long-term care facilities who were disconnected from loved ones. Like talk about focusing on what matters most. That's wonderful. Thank you for sharing. So one more video. Our next speaker is Kevin Radford, who works closely with the Government of Canada at Deloitte as a senior advisor with the financial advisory practice. He was previously the Senior Assistant Deputy Minister of Real Property Services with PSPC and a Senior Assistant Deputy Minister of Operations with Shared Service Canada. So over to you, Kevin.
Hi, my name is Kevin Radford. I'm the former Assistant Deputy Minister of Real Property Services at the federal level. I'm pleased to be part of this event today. When I think about COVID, I think back on my days of us trying to push a concept called a GC workplace. As real estate practitioners, we were trying to integrate technology, the workspace, and more modern HR practices, all of this pre-COVID, to try to make not only the best use of our workspace, but more importantly, to be more focused on our clients and those 280,000 public servants we were serving, to make sure that they were mobile, that they were equipped, that they could work from anywhere at any time, and kind of get away from the concept that work is a place I go, as opposed to work is actually something that I do. And then COVID happened. I retired this past fall, and it's almost as if you can see an entire mind shift change, where all the different departments that support government operations on a day-to-day basis got behind getting people equipped, getting people the agility they would need to work from home, and a very rapid change in mindset around work is no longer that place I go to, it's that thing that I do. And everyone was still able to contribute. And in many cases, public servants have just done an amazing job in ensuring that the right services are getting out to Canadians rapidly. And they're doing that with agility, and they're doing it virtually. So, extremely well done. As we think about the future of work, there's kind of almost 2 phases to it. There's that getting back to the workplace or returning to the place where I used to work, and that will be staggered. And as we think about it, I think one of the most important things for us to consider is employee trust. And how do you get that? Well, and in my view, there's this great realignment almost to, at the federal level, that vision for public service renewal and what that looks like. And they've got a moniker called Beyond 2020, but it's really about a public service that's equipped, that's agile, and that's very inclusive. These are wonderful opportunities as we consider the future of work to actually achieve those major objectives for the public service so that we can serve better. I think also, as we think about the workplace of the future and getting employees involved in the development of the strategy, that would be critical as we start to think about how policy will change, how services will change, how digitization, excuse me, will help us deliver services better. But there's also that opportunity to start working together differently. One of the options that we have put forward was something called GC co-working sites. And the idea there was we would make workspace available to any individual, any public servant, regardless of what department they came from. So as we think about services to Canadians in the security area or the social services area or the finance and commerce area and trade area, or even potentially in areas like science, what an opportunity to start rethinking what the workspace looks like, integrating new tools, integrating modern workplace practices, modern HR practices, the ability to work virtually, but also to bring departments together to advance new policy where more than one department is involved. Excuse me. So these are the kind of things that I think will shape the future of work. Nothing more important than getting employees involved in what that looks like. Nothing more involved than getting that work-life balance and the ability to recruit, retain the best and the brightest. Because some of the decisions that we make around infrastructure and around workplace and around technology, but particularly infrastructure, those things are with us for a long time, decades. So it's important to get it right. And what an exciting opportunity. Have a great day.
Thank you so much, Kevin, and appreciate the lens that you put on things as well, just in terms of the opportunity that we now have for public service renewal and how we work in this new normal. I think we all experience that every single day. So those were our 4 videos. I'm actually going to pass it over to Taryn Wasson, the chair of our IPAC board in NCR, to just wrap things up quickly.
Thank you, Jane, and thank you for everyone for joining us this morning. Aussi, je veux remercier nos conférenciers aujourd'hui. And you know, one of the silver linings of the pandemic is that by going virtual, we no longer have a geography barrier. So it was great that we had many participants this morning from across the country, including our provincial government colleagues. I know I see one of my friends from Newfoundland just in the screen here. The last time the pandemic has had such a, you know, kind of a, or let me rephrase that, the last time there's been such a national impact and a transformative kind of impact on society and the globe was actually the World War II, or both World Wars. And so following World War II was actually when IPAC was born. So I want to encourage you to learn more about IPAC, as after the Great Wars, there was a recognition that there needs to be a community, a network of public administration professionals from across the country, regardless of the jurisdiction, all orders of government, and so that we can kind of share these best practices, share these insights, share learning from one another. So I do want to encourage you to learn more about IPAC and become a member if you haven't already. Hopefully you thought that was a fantastic event, just like I did, although it might be a little bit biased. So I want to encourage you to fill out our post-event survey. If you registered, you should be receiving an email with the survey soon. And stay tuned for our next event. So we recognize the pandemic can be a challenging time for many of us, if not all of us. And to raise spirits, what's better than laughter? So on November 12th, 2020, we're going to be doing an event on Yes Minister, which is the classic British sitcom on government and really the dynamics between a public service and a deputy minister and a minister. So en français, le 12 novembre 2020, notre prochain événement, ça va être sur le Yes Minister. C'est une mission d'Angleterre sur la fonction publique et les dynamiques entre la fonction publique et le ministre. So thank you again. I don't want to take too much time. And please complete the survey, and I hope to see you again in a couple of weeks. So thank you. Merci. Bye.